So the next question, going to go to Carol with, I'd like for you if you can talk about what steps your organization has taken to expand leadership opportunities for ethnic minorities in health services management. So how has your organization helped to expand those leadership opportunities?
Sorry. So I'm probably not the best person to talk about that. I can talk about I can talk about it in general, but again, I'm very freshly new to the administrative side, but I can talk about the efforts on the clinical side and what we're looking at. And I would say that one of the biggest issues that we face as an organization, in addition to the numbers of ethnically diverse, and personally, I try not to use the word minority anymore because we're not necessarily minority, but of ethnically and racially diverse people who work here, you know, it's what we've learned and is not just about the numbers. And as a physician, I can tell you that it's not just about the numbers, it is about the leadership opportunities. So for example, we are very overrepresented. If you look at the percentage of US oncologists who are of Asian race, our faculty is very overrepresented in terms of that percentage. However, the leadership of clinical and research services departments, Asian physicians and scientists are underrepresented. And that really goes into how important leadership is. Memorial Sloan Kettering also has an extremely diverse workforce on all of the lenses that Mecca just described. But again, it is about leadership opportunities. I would say one of the most impactful things has been on the general employee, non-physician and faculty employee side, has been first the establishment of what we call employee resource networks, which I don't want to say this wrong, but it's probably at least 8 years ago now. And that really changed the culture. It allowed the employees to be celebrate what made them diverse or celebrate, and it translated into actual huge leadership opportunities because the institution didn't set these up as just a social group or a groups for people to sort of commiserate or celebrate together. They actually empowered and charged the employee resource networks as taking action. As Mecca said, inclusion, and they have been incredible leaders and partners. And each one of the groups has 2 or 3 leaders, and they have a term limit. And it has just been amazing for me to see, who has really struggled with the leadership opportunities on the faculty side, because there's a ceiling. There's only so many chairs. There's only so many service chiefs. This was a brilliant, brilliant strategy because it's given significant leadership opportunities to a wide variety of folks who have then, I've seen, gone on and gotten leadership opportunities in their day job because of their leadership of these groups, which are highly visible, are brought in to deal with major problems and challenges, including the all of the trauma around the George Floyd's death. So I would say that that has been an amazing, amazing program. And it's not something you would usually think about. You would think, you know, formal executive leadership training, that kind of thing. That at our institution has been a game changer for the employees. Absolutely.
Thank you, Carol. Mecca, can you share your side on this?
Sure. I think for us, you know, and similar to what Carol just talked about, we have opportunities that kind of run the gamut. Some are for existing staff, some are for people we want to bring into the space. And so I'll start with our existing staff. One of the things that we did is not run from our numbers. So the numbers are what they are. Your workforce demographics are what they are. And, you know, like many hospitals and looking at our demographics, we knew we had to do more with regard to leadership, but we also found that when it came to our mid-range, mid-managerial levels within our network, we actually were over the national benchmarking standard when it came to diverse representation. And so while we continued to employ initiatives that were all about recruiting people into the organization, we started to really focus on that mid-range managerial level to say, how can we retain these people and how do we grow this diverse talent into leadership positions? And as a result of that, we developed two initiatives in particular. We created our Women's Leadership Initiative, and that consists of a forum. It consists of a 6-month professional development program in which junior women who are selected, who are rising talent within the organization, are paired, and they come to hear from learnings from female leaders within our organization, senior female leaders. So like myself, senior vice presidents and above. And that program has been highly successful. Additionally, we created an emerging leader mentorship program. Again, a program designed to look at the emerging talent within an organization. These are people who haven't yet ascended to leadership, but again, are well on their way and want to invest in their own success. And so we paired them again with members of the senior leadership team over the course of about a year, actually, where they do one-on-one mentorship, really sponsorship when it comes to future opportunities, and those kind of one-on-one interactions so that we senior leaders become aware of who the talent in the organization is. Some of the efforts that we've talked about that have somewhat been derailed in light of COVID are creating network opportunities, create informal opportunities within our organization for the leadership team to just mix and mingle and get to know the workforce members who are interested in just saying, hey, I'm willing to step up. I want to do more. We've talked about creating cross-divisional or cross-departmental projects. So someone from legal may be working with someone from operations in a space that they never would have considered, but they find out they've got a talent and a skill set that is transferable. So creating those opportunities to recognize talent, and that talent comes in many forms and fashions. We also partner with the Greater New York Hospital Association every year as part of their Summer Experience Fellowship Program. That's a program specifically designed to bring diverse graduate students into healthcare, who are interested in healthcare management, into organizations where they are paired for the summer, again, with a senior leader. And they get to work on a specific project. They have to report out on it. It's been a phenomenal program. I have really enjoyed participating in it. At our organization, our CEO sits down with the students every year and talks about his journey. He shares with them how he got into this space and what the challenges are and what the joys are about healthcare management. And it gets them to think about this work in a different way. And again, it gets them to think about the work coming in a supervisory or a higher level that is attainable and is achievable for them. We partner with colleges. We have many colleges throughout our 5 counties that we represent throughout the Hudson Valley. So we partner with them on internship opportunities, nursing internship opportunities to really expose college students who are interested in going into the health professions. We also do work even before the college level. You know, so much of looking at how do we create diversity, because we know that that is waning in some of our health systems, of some of our doctors in particular. How do we create an interest and get young people to be excited about this work? We partner with Judge Judy's Her Honor program that is all about getting young women who come from underserved, underrepresented populations to see what it's like in various professions. We get girls. I have a student now who's my mentee from Mount Vernon High School who's interested in being a pediatric ICU doctor. And, you know, she is phenomenally talented and intelligent and excited. And we have a chance to, again, show these students the array of professions that are available for them in healthcare. Internally, we have our own Pathways to Practice program. This is a program we do every year throughout our network where we invite high school students in and rotate them through the various departments within a hospital. They see physical therapy, radiology, telehealth. Many of them are very tech savvy, and so we show them our state-of-the-art telehealth services. And again, it's interesting because in talking to these young people who theoretically, you get them interested, will go on to become the talent pool that we at hospitals and throughout healthcare will be seeking and looking for. Many of them, when they see me walk in the room, when they see some of our other diverse leaders walk in the room and share their stories, it's the idea that they see it, they know they can be it. And we talk about the fact that this is not unachievable for you. And it's extremely rewarding. Many of those high school students come back and volunteer in our organization. Many of them come back to work for our organization. We've actually hired several of the students who came out of the Summer Enrichment Fellowship Program when they finished with their masters. And so these are successful investments for us. We are investing in our future workforce. If it doesn't exist now, we are growing a workforce that we can then tap into and fostering and coveting relationships with those young people so they can see the important contribution that they can make to healthcare. And so those are some of the things that we're doing within our organization to really grow that leadership level. But I tell any organization that really is committed to doing that, first see where you're at. See where you're at, and then you know how to target and you know how to move forward in a way that is strategic. It is impactful. At the end of the day, we always want to be impactful. And it's something that's sustainable within your organization.